crazy to be on this side.
Yeah, there you go. What do you think?
Wow.
So you had surgery last Wednesday?
Wednesday.
And Thursday? And how did it go?
Good. You were in there 44 minutes and took almost 9 feet, I believe is what you said.
Yeah.
So, but I wonder,
Yeah.
because I felt so good after that I thought maybe you just stabbed me 5 times and didn't do any work. So I'd like at least a fee review of some sort, because this doesn't seem right.
Well, actually, that's a really good question, because you know this is the land of make-believe and illusions.
No, I know.
And so we've got this whole scam going. It's like, what was the guy who made him drink the Kool-Aid? The Jim Jones guy? See? Okay, so nothing really happened, but just because you believe, you know, it's like Tinkerbell. So all these people are losing weight purely on just belief. How about this question? We've had this before, and actually I was training a surgeon, and the daughter of the CEO of the hospital had surgery with us. So I was kind of hoping it would go well. And it turned out she called 3 days after surgery sobbing and crying. And I said, "What's wrong?" She says, "Well, I don't feel any pain. I don't think you did anything." So in your case, or in her case, what we'd say is go eat a bowl of ice cream fast. Lo, I am with you, even until the end of time. Yeah.
Well, last night I went to, I took my in-laws to, or my aunt and uncle to Jason's Deli, and I thought, all right, cup of gumbo, sounds good, can do that. And that baked potato looks really good, so let me try one of those. So I took a few bites, and they bring out these potatoes. I don't know where they get them. I don't think they grow them like that.
Yeah, they're from the moon.
Yeah, so I had a few bites of that, and it tasted great. But then I was done, and I'm looking at this potato thinking, you know what? 2 weeks ago, that'd be gone already. And I left the whole thing, and they finished it perfect.
So you can
tell. Yeah, so I can tell. Yeah, I can now, but it went really well.
Well, that's good.
Yeah.
So your week has been okay? You sent the email saying you're doing pretty well? And
yeah, blood pressure came right down. 121/77, and a resting heart rate of 66, which is outstanding. So thank you for that.
And it is funny to say, but that actually is life and death. In other words, they've done plots where they calculate, they find a bunch of people and they follow them for years, and they find their pulse rate or their blood pressure. And basically, if you lower your pulse rate and lower your blood pressure, you live longer. And it's just, you can draw a line. And so when we drop your blood pressure, you get longer life.
It's just outstanding.
Yeah, that's cool.
Yeah, very cool.
Good. Questions? Anything that's not clear or that we should answer? Or?
The only thing I'm really a little bit worried about is the color of the urine. It seems like it's too dark, and so I'm probably not getting enough to drink.
Possibly. It turns out that when you go through the surgery, you don't get much to eat for the past week. And so your body, in theory, should go and just burn fat. If it was, you know, if you were set up correctly, if you think about it, you'd say fat is like your savings account for a rainy day. Well, now we've stopped you from eating. If your body was doing the way we want it to, it would wander back to the savings account and withdraw calories from the fat to run your body. But your body doesn't do that well. If your body was good at doing that, you wouldn't be here in the first place. If your body was good at burning fat when you needed to, you would be thin. So what your body's doing against our wishes, and we don't like this at all, your body instead is burning muscle. And one of the side effects of burning muscle is you burn up the DNA in the muscle cells. And the DNA in the muscle cells gets metabolized to nucleic acids, and then to purines and pyrimidines, and then to uric acid, which then discolors the urine. And so a lot of our patients who have gout have the worst gout attack of their lives right after the surgery. And then they never have gout again. But you can have gout with the surgery. You can see that discolored urine. And for about 20 years, I worked at the University of North Carolina in Chapel Hill, and I did this kind of surgery with the open incision. I did the old stomach stapling and the Roux-en-Y gastric bypass. And all of my patients would have a Foley catheter in, and all of their urine would turn dark and pink and funny colors. And for years, I sent all of those patients' urine down for tests because I thought it looked cloudy, like it was an infection. And I have hundreds and hundreds of urine tests which were all negative. So basically, you're probably fine.
Okay, good.
If you feel well, you're probably fine.
I feel good.
Yeah. Good. Yes, sir. We have a question from the floor? You have the floor, sir. Go ahead.
That's part of the wall.
That's right, okay.
If you end up having a gout attack, could you still take the colchicine to...
We want you to work with your doctor about that. Colchicine and indomethacin are the kind of common things we've heard from the medical doctors as far as treatment. But it's something that we kind of discuss with your medical doctor. Both colchicine and indomethacin are drugs that can bother the stomach. So we have to be a little bit cautious about that and worry about that a little bit.
So just to be clear, would I take that 2 days after surgery, or if I have a good gout attack?
What we want to do is all of us talk about it. You and I would talk about it, and we'd get advice of your doctor.
Oh, okay.
We wouldn't just say, since you're on the floor, go ahead and take your... Since I have the floor now, I think I'll... Questions? Anything that's not clear to you?
Actigol, that's something we start later.
Mhm.
And is that prescription?
Yes.
Okay, I don't remember seeing the prescription.
If not, you can always call us, and we'll call it in.
All right. Good enough. I think that's it.
Lisa, hi.
Yes, hi.
And how was your surgery was Thursday?
Yes.
And it sounds like Steve's went pretty well. How was yours?
Mine went fine too.
Did okay?
Yes.
All right. And how much did we bypass?
I think 8 or 9.
Yep, right at 9 feet, I think. Yeah, good. How's your week been?
It's gone pretty well.
Good.
I had a really sore back, which, kind of slowed my progress, but
Right.
I don't think any issues related to the procedure.
Good. Okay.
So,
Questions or anything you're not clear about?
well, I didn't see a prescription for the man patch.
Men, if you think he needs a patch,
I'm not saying a word.
right, you're a wise man, Steve. But we haven't seen that men need it. But we have seen oftentimes that women will be grumpy or tearful or sad or angry, annoying.
She hasn't been
And it's not them. It's actually just the fact that there's a tremendous elevation in estrogen when you're overweight, and that decreases precipitously afterwards. And it's like going through a pregnancy or menopause, where after the birth of a child, some women get postmenopausal depression. So if you're noticing that he's annoying, it might be worth trying the estrogen patch but not for him.
So medicate him through me, is that what you're saying?
Well, I want to be careful how I say this.
I'd rather that you say it.
Right.
No, it's okay, I get it.
Yeah. All right, other questions? No? Any questions from the floor? No, sorry.
Dr. Rutledge?
Yes.
Because there's a bunch of us Canucks, we just get the Actigol from our doctor, from our own PCP?
It's Ursolia in Canada.
Okay, thank
It's got a different name.
you. Okay.
If you want, you certainly can get it here. But you can get it there too.
Okay.
Canada has it.
If I get it there, I don't have to pay for it.
Then I would get it. Let me think about that one. All right, Steve, do you want to get yours?
After me. I thought that might hurt, but it doesn't.
Not too bad. Huh? Say that louder so they can hear it on the internet.
It doesn't hurt.
Right. Now, Lisa, you have a two-piece? Okay, good. All right. Okay, take a look. Have you guys weighed yourselves?
Not yet.
No?
See that little redness there? Did you leave the bandages on?
I changed them, I just put the Band-Aids on.
Yeah, don't just leave everything off, because see that redness there?
Mhm.
It can get worse.
Okay.
And you can get ulcers.